My name's Annette. I was actually born and brought up in Lochcarron and came back to Skye 20 years ago to work in Broadford Hospital, and I've been working as an advanced practitioner there for the last 5 years, and just in the last 2 months I've taken on the associate lead for the rural support team, who are looking at providing urgent care in the north of Skye.
Hello, my name's Adam MacDonald. I'm from a tiny village in the far northeast of Scotland called Canisby in Caithness. I've recently moved to Skye and I'm living in Broadford at the moment and working as an advanced nurse practitioner within the rural support team within NHS Highland. We've got a really mixed bunch, so it's a combination of very experienced paramedics who have done their advanced clinical practice training to become advanced practice practitioners, and nurses both from the local area, from Skye, Lochalsh, Wester Ross, who have come to Skye and want to work here, and some people who have come from down south, so from a completely different background, up to NHS Highland to work in this area. So it's a really varied team. Everyone's got a different skill set to bring to the team, so we're really passionate about developing this service and making it the best that it can be.
And if one of us doesn't know, there's usually somebody else that does, so it works quite well from that point of view.
Ultimately, our team is here to deliver the right care at the right time in the right place, and that means that we want to be able to identify appropriate cases of minor injury and minor ailments to see, treat and discharge within the Portree Urgent Care Centre. We can do that by really encouraging members of the public to contact NHS 24, and only that way can we identify the appropriate patients who could be seen here in Portree, but also signpost emergency cases either through 999 or to self-present to the Broadford A&E, or if they need be, transferred off the island for appropriate care. The whole team's really excited about reopening the urgent care centre in Portree for minor injuries and minor illnesses on weekends and bank holidays from the 9th of January. We're working really hard to prepare for that, and it's a really key part of our role. The rural support team was founded on the basis of delivering this sort of healthcare within North Skye, and I wasn't here in the team at the time, but hugely frustrating to have to close because of staffing pressures. So we've got 8 advanced nurse practitioners and paramedic practitioners in the team now. We feel ready to get back to work in Portree, and we're really excited to get the place open.
As the various members of the team complete their training and gain the relevant experience, we will be looking to gradually increase the hours that we can offer at Portree, but that'll be as and when people are ready.
In an emergency, if you've got severe chest pain or can't breathe, you should, if you can, phone 999 or get somebody else to phone 999. If you feel that you've got a minor injury such as a sprain, a strain, a cut, and you'd like to be seen by one of the advanced nurse practitioners, the best thing you can do is contact NHS 24, and there you can be signposted to the right care in the right place at the right time.
NHS 24 has, over the years, got a bit of a bad name. People don't want to phone it because they feel like they're either waiting on a call back for like 4 or 5 hours, and whenever anybody's ill, of course they feel that it is urgent, but there's been a lot of developments in NHS 24 over the last year, and they're now answering over 90% of their calls within 5 minutes. And once you're through to NHS 24, they will deal with your call there and then. You don't have to wait to get somebody to call you back. So you could save yourself a lot of time by calling NHS 24 and getting seen at the appropriate place, rather than having to just drive to Broadford because you're not sure where to go.
It's really important that if you need urgent care to phone NHS 24. That way, if you do need to be seen by the rural support team in Portree, we can schedule your attendance appropriately. We might already be out in the North Skye area, for example, delivering end-of-life care to somebody in their own home, and that way we can avoid you having to wait for extended periods of time whilst we're seeing other patients. The vision for the rural support team is to ensure that every patient requiring unscheduled care is seen and receives the right care in the right place at the right time.
I think it's important for people living in the remoter areas of Skye to feel safe and know that if they are really unwell, that they will receive treatment. There is 24-hour emergency treatment available on the island, and that is predominantly through dialing 999 if you're really unwell. But if there is a need to be seen in your own home, say for like the elderly who can't get out, who have no way of getting to Broadford, that can be arranged by dialing 111 and being directed to the appropriate care, or having the appropriate care directed to you. But I think it's important for people to know that they, by either dialing 999 or calling 111, they will receive the care that they need. So all of us are basics trained, which means we train with Basics Scotland and work closely with the Sandpiper Trust, who provide bags of emergency kit that are fully equipped to provide emergency care, like at road accidents or a cardiac arrest or severe asthma, and we carry the kit in the car. Basically a mobile service that can give all the same treatments that you would get in the urgent care centre itself. The See and Treat service is activated through 111, where 111 would contact us and either arrange for us to come and meet somebody up in Portree in the urgent care centre, or for people who are unable to travel because of age or their illness, we could see them in their own home, and that would include seeing patients who are at end of life and need palliative care.
From the 9th of January, we'll be available to see patients who have a minor ailment and can't be seen by their GP surgery because they're closed at the weekend. We support the GP out of hours service on the Isle of Skye, and therefore if you do need to be seen by an advanced nurse practitioner at the weekend or on a bank holiday, you can do so by contacting NHS 24 first. If you start to feel unwell or have an injury on a weekday, it's really important that if you don't feel the need to call 999, that you phone 111 and talk to NHS 24, because if you can be seen in Portree, then we can arrange to do so at the right time.